Well, good morning, everyone. It is May, what is it? 19th, 2025, the favorite time of our week because it's Mondays with Bev and Paul. And hi, everybody. My name's Paul.
Oh, hello. Good morning. This is Bev.
Yes, sirree, and the favorite time of our month.
Because we're together
We're
again.
together.
And the same space, breathing the same air. Yay.
We are one today,
Yes.
folks, and we're going to talk a little bit about what that means. We're going to talk about a new topic in town. I went to a little seminar and found out about what's being called precision medicine.
Wow.
Yes, sirree. You heard it here, folks.
First.
For the public.
Yeah.
I went to a special meeting of all these doctors. So
Hey.
anyhow, the first thing we want to do is go over our dream catcher.
Yes.
And I don't think you know. This is Fred. I can't remember Fred's last name.
Fred, he
Fred,
looks familiar.
Oh, he was way before your time.
Really?
Oh,
I
yeah.
must have seen a picture of him before.
Yeah. Fred was just awesome.
Aw.
I think
Hey,
he was he hit it off with John because he was from the New York area.
Oh,
and
yes.
the
Oh, yes.
Italian community.
Definitely.
They were brothers.
Definitely.
He was certified. He was great. He was so supportive. Really hung out here at the center all the time.
Oh, wow.
Worked with us. So we put. He's long gone now.
Yeah.
He's in the center of our dream catcher.
All right.
We put out the good juice to Fred and wishing him well on his journey on the other side.
You bet.
If you would like to be in the dream catcher, that's sort of my last pictures of those who have passed on. I'm going to try and find a few more.
All
but
right. Yep.
Send us a
Done good so
picture.
far.
Send us your name or of a loved one or yourself, and we'll put him, her, it, they in the middle of the dream catcher.
Yeah. That's wonderful.
Yeah. Okay, so here we go. We're going to talk about precision medicine as I learned about it. But BioTouch has been talking about it for 35 years.
Tell you. Absolutely right.
So I went to this little conference thing. It's the new buzz in the medical community. And I'm just going to give you, I looked it up. What is precision medicine? And according to the Precision Medicine Initiative, there's an initiative out now. Precision medicine is an emerging approach for disease treatment and prevention that takes into account individual variability in genes, environment, and lifestyle for each person.
Wow. No, I just think that's amazing. But maybe this is what we've been heading for a long time. As you said, when you talked to me about that, I thought, well, BioTouch is already, we're way ahead of the game. Let me tell you, because, the first thought that came to me is reminding myself that as a group, humanity is a unity in diversity, isn't it? We share the same very important thing. We all have a body with the same working parts and the same, heart and kidneys and lymph system. We all share that. But what I like about this precision, and really starts me thinking about, wow, how powerful BioTouch is that each of us are living in our bodies with unique experiences living in that body. That's what precision medicine is here to do, to address your specific. So I've always thought about BioTouch as a personalized, custom-made technique. It just, and part of that is understanding that the body itself is the one that we want to communicate with. It knows what it wants. It knows what it needs. And BioTouch gives the body what it wants and gives the body what it needs.
Right. And, let's talk a lot about that. The main thing they were talking about was the whole genetics and the genome projects that are going on. They talked about, what did I say here? Genes are the software code. Epigenetic codes is what you do each day.
Isn't that?
And so it's that, each person, and they talked about interesting thing. They said allopathic medicine, and they even said integrative medicine,
yeah,
are they're specific. They're not specific. They're dealt with one thing works for all. Take vitamin D and it'll do A, B, C, and D.
Gotcha.
You know.
Yes.
And so that it's not very specific oriented compared to what they can do now.
Right.
And I think that's why we no longer need to say BioTouch is part of integrative medicine, because it's really part of the precision medicine
And it has been.
paradigm. Yes, because as you were saying, as you address the body knows and figures out what it needs.
Yeah.
So there were a few things that we talked about with BioTouch. BioTouch empowers folks to listen
Ooh, that's big.
to their
I
their
love
body.
That. I love that.
What do I need? You know, how many times have we
man.
said, you know, people all of a sudden are eating broccoli and they couldn't stand it before, you know?
Well, this is you know, we mentioned that in not those words, but it's totally about our vision statement. This is encouraging this self-awareness, this to make these different choices, to go in maybe another direction, to feel empowered to change what's not working in your life. And you know, I've had some people go, how does that happen when you just touch the body? It's a communication system down to the cellular level. I believe that. It gives the body exactly the tools that it's looking for, and it knows what to do with that. And from then, things start to open up. There's so many different parts of ourselves that start to respond, not just the body. That's where it all takes place. We've said it many times. The body holds the experience, the trauma, the cellular, the DNA, the genes. It holds everything. And when you give one person that touch for whatever condition that they are experiencing, it's like a brand new way of talking, and you begin to listen. I love that. We are so programmed not to listen to our bodies.
You know, and it goes the other way with the broccoli. I've met numerous people who were whole living foods, you know, their body was starting to eat itself. And they went out and had a Big Mac and never felt better. So, yeah, how many times have we said over and over, we have no standard protocols. We don't even tell people, oh, you better drink water when you're done. What we say to people is listen to what you need and then follow that, you know, and that's the key.
That's it.
And to trust it.
To trust it. Well, I know, and you know, all of us at the center, we've finished a session with a recipient and been sitting out here, and they walk out of the room and they're like, wow. And the first thing they say is, hey, should I make another appointment? Right. They're already listening. And what do I say? I don't know, should you?
Right.
So we're enablers to, you know, what should I do? Should I come back? I don't know.
Yeah, we're enabling people to be precision medicine.
Yes, to listen to themselves, right.
So another thing we find out with BioTouch is it empowers folks to find their own research. I mean, there's enough information. Part of the whole precision medicine thing is really working with AI, these new watches, blood things that you can do. I mean, the thing in the next 10 years will take people to the point where you get all the data for this body, for this DNA, this gene, the genome, whatever it is. So when you go into your practitioner, here's the data.
Yeah.
And then they can do the research, because there's so much research out there. Any one doctor or healthcare practitioner can't keep up with it.
Yeah.
And so then you create this design for that individual person. So it gives people the opportunity, as is happening with, you know, well, we'll talk about that in a minute. But and so you can do your own research, empower you to do that. It also empowers folks to dialogue with their healthcare provider.
Oh, definitely.
Because when you know what this body needs, when you can feel it, and you are being told by a group of people, just trust it. Then you talk with your healthcare provider. Hey, you know, I'm not sure I want to do that. How about this? I was looking at this.
Yeah, you know the questions to ask.
Yeah.
So how many times do people just sit there and say, okay, whatever you say, you're the doctor, and they don't participate in their own journey.
Right.
That's the one thing that I like about this new approach. It really kind of forces you to come into, well, BioTouch definitely does. It, after a while, you can't help it. You just, you start listening. It changes something. Has the power to change us and to improve the quality of our life.
And that's the key, and we'll show that with the research, because part of this seminar I went to was about healthy aging.
Yeah,
They
that's
talked
a big
lot,
one out
right?
there.
And
Yeah.
our research with Dr. Kenneth Stevenson showed how adding BioTouch, well, let's just show
It's
it now.
just that.
Yeah,
That's
and so
exactly
here's
what it
all these
does.
things in this chronic stress chart. You can see all the things outside. Those are the things affecting us, and we're interacting with them, and it's creating that individual. Just because you have, let's say, prostate cancer, it's being held differently.
Yeah.
Or you have atrial fibrillation.
Yeah.
It's being held differently. You might know it, you might not, but all these things are affecting us, tobacco, relationships, the environment, diet, drugs, the genes. There again, it's just
there it
part of the
is.
stress cycle.
Right.
Psychological stress, emotional stress, childhood traumas that we might even not know about, socioeconomic status, politics, all these kinds of things. We're on a global media thing going on now. You open up your phone and you're across the world watching, the annihilation
This
of
is
peoples.
it. Yeah.
Wars going on. And so that creates that chronic stress, which creates immune dysregulation, cortisol dysregulation, and then moves into the diseases we have: dementia, cardiovascular disease, infection, benign tumors, mood disorders, obesity. But every one of those, if you put 4 people together with a cardiovascular disease, they were showing on these charts, when you really check out the DNA and the genes, and there's all these machines now, 4 people with cardiovascular disease have a whole different design of their DNA.
Yes.
Whole different design. And so this medication might not work with that person, or this herb might not work with that person.
Right. That's what I was talking about earlier. We all have a heart.
Right.
We all have a circulatory system, right? But every one of those 4 people are going to experience in that body a diversity. That's the diversity. So it's amazing.
And so what's nice about that is, before it gets to that point, you see there, we add BioTouch into this chronic stress cycle, equally for everybody.
Right.
And so then what you see is BioTouch improves the circadian pattern of cortisol release, which improves your quality of life. And it increases what's called interleukin 12 to improve immune system functioning, which increases the activity of genes that fight infection and cancer and promote healthy aging.
There it is.
Then if you have any of these diseases, your body, you're going to know what to do as you work with that clinician who knows, maybe a little more than you do, and hopefully so.
Yeah, hopefully so.
About the different options.
Right. Absolutely.
The other thing we found with BioTouch, and Bev and I are probably great examples, but I've seen it many, many times with different people I've worked with, and that is people who are getting BioTouch, they seem to attract a medical team perfectly situated perfect for their situation. A medical team. And so, like with your situation, people were telling you about, this town they don't have
this
good
hospital sucks,
right.
and all this, and nobody's good on there.
Right.
Well, was it me? Because I had just the opposite experience.
Right.
Yeah.
And you had a cardiologist who said what to you now?
Oh my! He first of all said I needed to understand that on this journey that I'm on, he's there with me, and at any time, if he should suggest or say something that makes me uncomfortable, we're going to do it my way. I'm like, huh? What? Wow. Okay.
Right.
Oh, amazing.
And with my prostate thing, I found a team that even other medical providers said, oh my gosh, you have a whole team. You have a urologist, a radiologist who are listening to you, and you can bring up these other alternatives and other possibilities, and they're encouraging you to do that.
That's amazing.
And a radiologist who works with prostate cancer a lot, I can text him. I can text him. Within 24 hours, he's texting me back personally. I mean,
you're his favorite patient.
Yeah, right. And that's, part of the precision. You're the practitioner's favorite patient.
Yeah.
Every person is their favorite.
I think so. I think it's just so perfect. It's so perfect what BioTouch is able to do. And I have a whole nother, we've been speaking the words, but we haven't used precision medicine. BioTouch is part of that community that's evolving. This is what excites me, because you've known for 35 years, I've known for a very long time myself, that BioTouch gives us that opportunity. But we just haven't put it in those words.
Right.
But we know, like you said, you take 4 people with the same condition, give them all BioTouch, and not only that, the practitioner with what we call extra work and enhancements is able to go even deeper in that personalization, right? It's just, wow. I mean, so perfect.
Yeah.
I want to be part of this new thing.
Oh yeah.
Here.
I mean, and that's another reason we're trying to get BioTouch out to the internet, into the web.
Right.
You know, and why we have such a big website and so many words on our website and so many health conditions that we can work with.
Yeah.
To make it a part of when you go to the medical practitioner and they look up, okay, what are the different things we could do? BioTouch will hopefully pop up.
Be one of them, for sure.
As an opportunity to help you through your health care journey.
Yes. Your healing journey.
Yes.
It's a healing journey that we're on.
And remember, you can't hurt anybody with BioTouch.
Nope.
It can only help.
No side effects, guys.
Yes, no side effects.
No side effects.
You know, and you might be taking this medication, and I've seen this before too. People have been taking a medication, they'll get their BioTouch. They've been able to cut back on their medication.
Yeah, definitely. And that's why we encourage everybody to work with their provider, their medical provider, because if the body is allowed to do its thing,
right?
Well, you know, you're open to change.
Yes.
And you have to be present and listen to your body, and be willing to work with your practitioner, for sure.
So for us, nothing's changed in 35 years,
Yeah.
and we're glad to see this new dialogue called Precision Medicine. Check it out, look it up. You'll see in the next 5 to 10 years, there's going to be a revolution in medical care
I think
because
you're
of what
right.
they can do with these computers and
Yeah.
AI and
Crazy.
and analyze your data. I mean, I saw a thing came up on my feed today. You can go in for these MRIs now and it'll check 220 things. I mean, some
Wow.
people want to go crazy, and find out what exactly is wrong with me.
Yeah.
But you know something? At least get BioTouch, in your daily life. Start it with the kids when they're born. So, Kai,
Yes.
one of our instructors started it with her kids right away, even
She
when they
did.
were in
Even
the
the womb.
Yeah.
Yes.
And it could help us deal with this environmental impact that we're having all around us.
Well, that's one of the things, isn't it? Because it's BioTouch can help with our stress levels, not just
Yes.
pain, but the stress of it's hard sometimes to be here.
It is.
And
it's hard.
if you get BioTouch, you have that moment of just peace and safety,
Right.
that it gives. Yeah.
And when you talk about that, it's about not feeling guilty if you have some kind of a quote disease that they put, atrial fibrillation.
What?
Right? Oh, not me.
I'm like,
prostate
what?
cancer.
Yeah.
Oh
What?
no. Hey, it's part of your journey.
Yeah.
And BioTouch can just help us accept it, work through it. It's not who we are in reality, but it's certainly part of our little story that we have to deal with.
It is our story.
And BioTouch can help us write
Just
the ending.
do the best that we can.
Do the
right?
best we can.
Yes.
So we hope you want to learn BioTouch. We do have a class coming up on the 28th. I guess that's next week.
Yeah.
On a Wednesday. It's a live virtual training, 9 a.m. to 4:30. Check us out by justtouch.com. And we hope you will participate with us in this new precision medicine protocols.
Yes. Oh.
Thanks,
Join
Bev.
the journey with us. Thank you, Paul.
And
Thanks,
thank
everyone.
you, everybody. We'll see you all next week.
We will. Yep.
Let's see the closing song.
Days in and days out, space and time is all about feeling pressure with the pain, in sunshine or in the rain. Living is a place in mind, giving is being kind. When the pain is too much, what we need is bio-touch. When I'm touching you, you are touching me. It's a simple thing to do and a natural way to be.